So here is the educational portion of our show. So what do you think is the most common surgery for children? I'm going to tell you it is ear tube surgery, and that makes perfect sense to me. Here to talk about a procedure that has been very successful from Advanced ENT Allergy is Dr. Amy Ingram. Dr. Ingram, welcome to the show.
Thank you.
You know, that makes perfect sense to me because you and I were chatting a little bit. Whenever you talk to parents, there comes a time often that they say it's time for my child, my son, my daughter to have tubes put in their ear, right? Mm-hmm. Yeah. So I was reading here 700,000 surgeries performed on children in an operating room every year. 700,000 ear tube surgeries, right? Mm-hmm, mm-hmm. Okay, so you're here to though tell me about something that you guys have helped innovate, and it's called Tula tubes. Mm-hmm. So explain.
So what they are is most of the time what tubes include are going to the operating room. Kid has to be, they can't have anything to eat after midnight. They go to sleep, which is a very short procedure. We make that hole, put the tube in, but then this new it's really innovative is they actually come to the office. They can come after they've had breakfast, after they've had lunch, after you picked them up from daycare. They come in and they have it's like an earplug that's filled with a numbing solution, and they sit for about 10 minutes, and then once that eardrum is numb, then we lay them down, and actually this device that's actually right here is what actually puts the tube, makes a tiny hole and puts the tube in almost instantaneously.
So it's made it, to me, it sounds like a lot less of a hassle, mm-hmm. probably more relaxing for the child and the parent as well, right? That's the goal.
Somewhat, yeah.
All right, I like this is good, and from what I understand, also Advanced ENT and Allergy you're part of the innovators. So you're the ones who've done this. Tell me about your involvement, yours, and I think Dr. Gould, who is I guess your partner.
Mm-hmm. Yes. So we were a part. This study first started. It's been about 2 or 3 years ago, I guess, when we first started doing this in office. We started on adults to make sure everyone was numb and that the tubes were in. Then we moved to kids in the operating room, and then eventually we did, I think both of us each did about 40 patients in the office during the research lead-in. So we were the top enrolling site in the country, and then we were 2 of the top 3 enrolling in the country as well.
See, I love hearing that, because part of the reason I am proud of being from Louisville is all the medical innovations that happen here, mm-hmm. and now you're a big part of that, so congratulations to you.
Yeah.
Okay, so before we go to a video that's going to kind of explain and show you a little bit of an experience of a family who used the Tula tubes, when do you know, as a doctor, when do you know it's time for, okay, let's look into tubes? Because a lot of kids have ear infections. What's that threshold? When do you know?
So over 3 infections in a 6-month course of time, or sometimes it's not just infections, it's a kid is just holding fluid, and so they've got hearing loss. And so if a kid has had an infection and maybe they don't get another one, but they have fluid for 3 months after that, that means they're basically walking around with earplugs in their ears, which is the reason my son actually had tubes. I hadn't even looked in his ears. What a great ear doctor! But our pediatrician looked in and said, "Oh, he's got fluid." And so then, of course, as the ear doctor mom, I start paying attention, and sure enough, he had hearing loss, and he ended up with tubes. So, yeah, either of those.
Well, Tula Tube sounds exciting. If you're a parent, we wanted to give you a closer look. So again, it's Advanced ENT and Allergy, and this is a family. Their daughter went through the procedure, so you'll learn a little bit more about it through this video. Take a look, see.
Sloan, she is ridiculously into baby dolls right now.
She loves princesses, so we are just about always in a princess dress to go outside and play. We began battling the ear infections with Sloan when she was about 9 months old. It would always start with her having a really bad night sleeping, up all night, crying, get her ears checked. She had an ear infection, antibiotics.
We also noticed that her speech was not progressing like her older sister.
I brought Sloan in to meet with the ENT, and both being in the medical field, we're familiar with what tube placement entails. The child will have to be NPO or without food for a stretch of time. You're in the hospital during the day. There is such a small risk with anesthesia, that wasn't concerning to us, but any risk that you don't have to take is always a benefit. She then mentioned that there is a new in-office procedure that could be performed, and she thought that Sloan would be a great candidate for that.
I think my primary question was, how do you make it not hurt? What are the anesthetic options. How do you get this young child to stay still and not go buck wild with fear or with pain when the tube is placed?
They put in the eardrops, and gosh, they look like little headphones into her ears, and she just laid there. We brought her iPad. She brought a couple toys with her. She didn't have to be separated from us too. That was huge. To not have to hand her over to strangers. We sat right there with her, held her hand, talked to her.
It went successfully, and we were getting snuggles and slushies less than a half an hour later.
There was no post-anesthesia complications, the wake up in the fog, the anger.
As a pediatrician myself, I believe that the in-office tube placement option is a valuable one.
Every day of the week, I would choose the in-office procedure, assuming that the child is right for it and will hold still,
Can take instructions.
I personally feel, I don't know why you would choose otherwise.
It's the right selection, the right child, the right timing. Unequivocally, we would pick the in-office procedure.
Absolutely.
That's a good-looking, happy, healthy family there. So Tula tubes worked for them. So now I'm going to come back to you. First of all, I thought what was interesting, doctor, is that he was a pediatrician. And when you have a doctor recommending the procedure, and I thought it was also interesting as a father, because although I'm not a pediatrician, I would share the same concern. He said, I want to make sure it doesn't hurt. And you hear that probably a lot,
yeah.
especially dads with the daughters. You know, I hate to stereotype, but you're a little protective of your daughter. So who is a good candidate? Obviously, I guess anyone who needs tubes in their ear, but who's a good candidate as opposed to the other procedure?
So, so smaller children, so anyone less than kind of 18 months, at least hold still and let you look in their ears. If a kid is from the get-go kind of, and I have a couple of those, so that are wild and crazy from like the moment they walk in the office, is probably not going to sit still to let the those little earbuds that they were talking about stay in. And then the older children too, someone that's not super anxious. So if you got an older kid that's a little anxious, then they probably also are just not going to want to sit down. But I mean, those my first few were probably 6 to 8 year olds, because I wanted to make sure that those kids were numb. So if I figure if a 6-year-old's going to let me put the tube in on one side and then turn over and let me put a tube in on the other side, they definitely weren't in pain. So then I was, that's when I started being more and more comfortable with the smaller and smaller children. So the younger kids actually probably do great with it.
As a doctor, I'm curious from your vantage point, is this an easier procedure, or I'm just curious because you're the one that has to actually perform this. So,
so as a doctor, no, it is not an easier procedure. Obviously, when you have someone under anesthesia and they're completely still, that is going to be easier. But as a mom, and that kind of, I had the same feelings that pediatrician did. As a mom, just even any small risk, I have no. I bought in pretty quickly. I think I was one of the top I was the top enroller, and I think it was because I was a mom, and I thought, no way, I can hold my kid down for a vaccine. I can hold him down for a set of tubes for just a few seconds.
And I would think it would be very comforting for the child to have their parents
right there,
there for the entire time.
Yeah.
So what happens after the procedure? Doctor, what happens after?
They've got tubes.
It's done.
They leave the office hearing better than they did when they came in, and they can go they can go eat, they can have dinner, they can go back to daycare if they want to, they can go back to school. So yeah, they leave hearing better than they came in.
Okay, this all sounds good. It's you're checking all the good boxes. So, Advanced ENT Allergy. If someone is interested in having this procedure, if they have a child or a grandchild who is experiencing ear infection, time to get the tubes, and they'd rather opt for this option, what do they need to do? Call you? How does it work here?
So call the office and just ask for one of the physicians that do the in-office tube. So the Tula procedure. Most of our physicians do, but not all of them do. So in Indiana, there's I think all the doctors in Indiana do it, and then I'd say the majority of the doctors in Louisville do it as well.
Okay, Advanced ENT and Allergy. Dr. Ingram, thank you for your time and congratulations. This is really innovative. Very nice. All right, coming up here, it's